Anaiwan-Dunghutti woman who is the cousin of Nathan Reynolds. I'd like to acknowledge the traditional custodians of this land, the Darug people. I acknowledge their survival, their ongoing connections to the land, waterways and community. I'd like to pay respect to my elders past, present and emerging, and extend that respect to others here today, especially those that have supported us on this inquiry. Thank you.
Today I want to remember our brother, Nathan Reynolds. He is one of more than 440 deaths, 440 Aboriginal people who have died in custody over the last 30 years. But he's not just a statistic. He is forever remembered as a jokester, a talented tradie, a typical boy's boy that had a big heart. Nathan was our brother. He was a son, a father, a stepfather, a nephew and a grandson. He was deeply loved. Losing him has left a huge hole in the lives of our family. We miss him every day. It is soul-crushing knowing that just at 36 years old, Nathan died on the cold floor of a prison. We now know that he died of a preventable asthma attack. When he was sentenced to a full-month fixed term, he lost access to community-based health care. He was put in the hands of corrective services and justice of health. And in just 4 months, they watched as his condition deteriorated enough that it killed him. Nathan's death was preventable. Several times he went to the prison clinic and said that he wasn't feeling well. It was never any secret that Nathan was an asthmatic. He was given multiple puffers, which should have been a major warning sign. It should have been a major warning sign his asthma was out of control. Yet his asthma was never noted in the prison's chronic disease screening system. He was given no consistent, ongoing care for it. He had no asthma action plan. The prison system failed to recognise what Australian schools and workplaces have drilled into them all the time. Asthma is a serious condition. It can be fatal. Why is a system that is responsible for so many lives not aware of this simple fact? Why can schools get it right but not prisons? If anything, the prison system was doubtful of Nathan's medical needs. When he was dying of an acute asthma attack, the first nurse on the scene gave him naloxone, which is intended to reverse a drug overdose. In her evidence, she claimed that she would react the same way to someone having a medical episode on the street. We reject this. We believe that Nathan was stereotyped as a drug user because he was in jail. He was seen as a prisoner, not a person. Corrective officers walked to Nathan. They didn't run. They took 11 minutes to arrive, while our brother's life hung in the balance. Once they arrived, their priority was security and not caring for Nathan. At the inquest, one officer was asked in hindsight the one thing that he'd do different that day, and his response was, "Take a sickie." This was a disgusting thing for our family to have to hear. Nathan received medical first aid not from the prison staff, but from fellow inmates. To those men we say thank you from the bottom of our hearts. Thank you for giving our brother the care that he deserves. We came to the Coroner's Court today hoping to see accountability. We want the nurses and the doctor who saw Nathan to be held accountable for their failings, not just with a slap on the wrist, but with real consequences. We especially want to see this for the doctor who worked across 5 prisons at the time he let Nathan down. How many other inmates has he let down? Has his neglect led to any other deaths? The coroner formally recognised that Justice Health and Corrective Services contributed to Nathan's death.
Asthma has to be taken seriously in prisons. Chronic health conditions need to be managed proactively and consistently. Inmates should be believed when they say they are unwell. People should not die in prisons away from their loved ones. Last week, another 2 Aboriginal people died in New South Wales prisons. This morning, we were advised of another death in Victoria. Our thoughts and support to their families. No family should ever have to go through this. 2 weeks ago, another inquest into the death of Denny Whitten was held here at the Coroner's Court. Denny died in prison from a preventable medical emergency in 2015, 3 years before Nathan. Our brother was 36 when he passed away. Denny was only 25. How many more Aboriginal people must die before their time due to the failings of the Justice, Health and Corrective Services? We say no one. Change is possible. Our family is calling on the New South Wales Government, Corrective Services and Justice Health today to make those changes. Would like to thank everyone who has supported our family through the last 2.5 years. The team at UTS, Jumbana, have been great. Also the Aboriginal Legal Service, particularly Sarah, Craig and Josh, who have represented us through this inquest and have been a great support for our family. Now I'd like to hand back over to Sarah to say a few words. Thank you.
The Aboriginal Legal Service expresses our deep condolences to Nathan Reynolds' family, friends and community, and we stand here in solidarity with them today. To die in custody is an absolute tragedy. People who die in prisons and police cells take their last breaths without their loved ones by their sides. Their last moments are filled with panic, pain and despair. Last week we heard 3 more First Nations people died in custody. Today, Deputy State Coroner Ryan found that Nathan Reynolds died of natural causes that were contributed to by deficiencies in the management of his severe asthma and in the immediate response to his medical care. She found that the response to Nathan's medical crisis was unreasonably delayed, uncoordinated and inadequate. It deprived Nathan of the small chance he had of surviving his acute asthma attack. The signs of an oncoming asthma attack were present for weeks before it happened. The prison system cut Nathan off from health services that he relied upon in the community, and then it failed to replicate them. Today's findings articulate that there were significant failings by Justice Health. The outcome where Nathan suffered a severe asthma attack was predictable and it was preventable. Corrective Services and Justice Health failed Nathan on 2 counts. They failed to provide ongoing health care and management of his chronic asthma, and they failed to provide emergency medical care when it was needed most. And these failures cost Nathan his life. When questioned at the inquest, prison staff were unable to say whether they would have done anything differently with hindsight. They were unable to point to any significant challenges made since Nathan's death. Together, all of us must call on the New South Wales Government to ensure the human right of health care is not taken away when someone is taken into the care of the state. Without accountability, there is no justice. Like the Reynolds family, we came here today to get accountability and to prevent needless, senseless deaths from occurring in the future. The coroner has recommended that Justice Health and Corrective Services review a number of their policies and practices. We welcome these reviews, but what is needed is accountability. Constant reviewing will not create the change that is needed to save lives. If there are no consequences for failing to implement results of reviews, we are just waiting for more deaths in custody. Almost 30 years have passed since the Royal Commission into Aboriginal deaths in custody. Well over 440 Aboriginal people have died in custody since then. 3 more last week. Most recommendations of that Royal Commission have still not been implemented. You can see the depth of the family's loss here today. Imagine that multiplied over 440 times. Imagine how many families and communities are carrying this heavy burden of grief. Today we repeat our calls for systemic and personal accountability. Nathan Reynolds did not have to die. We call for urgent action to prevent further devastating deaths in custody.